This medicine to ECG review will focus on case number 412 from ECG Wave-Maven. Copyright information is provided here. A 64-year-old man with a history of hypertension and atrial flutter is noted to have group beating on his ECG. What is the rhythm? The answer: sinus rhythm with atrial bigeminy. The ECG shows a sinus rhythm with atrial bigeminy. That is, each sinus beat is coupled to a premature atrial complex. In addition, there are findings of left atrial abnormality, left ventricular hypertrophy, and nonspecific STT changes. Note that the P waves of the atrial premature complexes sit on the T waves of the preceding sinus beats, giving the misleading appearance of QT-U prolongation. Echocardiogram confirmed left atrial enlargement and symmetric left ventricular hypertrophy consistent with hypertension. The echocardiogram also showed right atrial enlargement, which cannot be diagnosed from the ECG in this case. Sinus rhythm with AV wonky-back would require the consistent appearance of sinus P waves with prolonging PR intervals followed by a non-conducted P wave. This pattern is not seen here. SA wonky-back is usually at slower rates and P waves should be identical. Here, the second P wave in each group is not only premature, but it varies in morphology from the previous sinus. The QRS complexes of the premature beats are nearly identical with sinus-conducted beats, further indicating supraventricular, not ventricular bigeminy. There is no evidence of atrial tachycardia here, although atrial bigeminy, particularly with atrial overload syndromes, may be associated with increased risk of sustained atrial tachyarrhythmias, such as atrial fibrillation, atrial flutter, and atrial tachycardia.